Good morning, respected judges and my dear friends. So my talk is on the world's first such clinical trial on PHAKIC IOL versus OCCLUT versus Orthoptech in children and adolescents for the management of amblyopia. So amblyopia is a neurodevelopment ocular disease manifested as monocular and binocular impairments, including vision reduction, contrast sensitivity, or even loss of stereoscopic vision. So occlusion therapy with best corrected spectacles, they have recurrence rate of 25 to 50%, and there is this OCCLUT is also there. So there is binocular polarized glasses are used. Same background is given, but the enriched foreground to the amblyopic eye is given. So the high contrast to the amblyopic eye and fast-paced engaging components are there. So it is based on the principle that they can strengthen a broad range of visual tasks in adults with normal vision, including light sensitivity, contrast, visual crowding, and visual attention. So this is how it is done. And now this new treatment modality, that is Orthoptech magnocellular stimulator. So there are 3 rows of LED lights, and the central one is green and the rest are red. And the light comes on and off for 150 to 200 milliseconds, and the patient fixates at the light and points at the flashing lights with a laser pointer. And the patient seated at 1 meter distance with best corrected visual acuity glasses. So 20 minutes with the amblyopic eye and 5 minutes each for the better eye, and 5 minutes with both the eyes. So this is how the saccadic area and the attention area, so they works opposite to each other. But the 4C alpha in the saccadic area, it stimulates the 4C beta, the parvocellular cell in the retina. So this was the world's first such clinical trial to analyze the demographics and clinical outcomes of PHAKIC IOL versus OCCLUT versus Orthoptech in the management of refractive amblyopia. So this was our methodology. It was a prospective interventional study on children and adolescents with amblyopia at a tertiary eye care center from Jan 21 to Jan 23, and 63 eyes of 63 anisomyopic and 3 isomyopic amblyopia patients were randomized in 3 groups: PHAKIC IOL, Group A, Group B OCCLUT, and Group C Orthoptech. So the patients were followed up at day 1, 6 weeks, 3 months, and 24 months after treatment. So these were the results. Demography, so almost male to female ratio was equal in all the 3 groups. Now coming to the visual acuity. So as we compared in the PHAKIC IOL group, so there was a significant p-value from 1.39 log mark. The visual acuity improved to 0.11. And again in the group B, there was a significant p-value as compared to the visual acuity improvement from 1.35 log mark to 0.12. And also it improved in the group C also, 1.37 log mark to 0.12 in the Orthoptech group. Now coming to the contrast sensitivity between pre-treatment to the post-treatment in the 3 groups. So the improvement was best in Orthoptech group with a significant p-value as compared to the OCCLUT as well as the PHAKIC group. And as we compared the comparison of stereoscopy between the pre-treatment to the post-treatment, so it takes longer time in the PHAKIC IOL group as compared to the OCCLUT and the Orthoptech group. So there was faster improvement in stereo acuity in the OCCLUT and Orthoptech group. So in the conclusion, in amblyopia there is a functional or structural deficit in the visual cortex, and the functional bold MRI, the blood oxygen level dependent MRI scans do shows us the way forward. As you can see the upper picture, it's a normal patient. The second patient is amblyopic with reduced oxygen level, and after Orthoptech treatment and after OCCLUT, there was improvement in the blood saturation level. So repeated stimulation of the magnocellular cells, they leads to stimulation of fovea, and these prosaccade is associated with maximal stimulation of the V1 area in the visual cortex. So the Orthoptech magnocellular stimulator is a novel instrument in the management of anisomyopic and isomyopic amblyopia in terms of faster improvement in contrast sensitivity, stereo acuity, and multicentric clinical trials are of course needed in other amblyopia and other attention deficit disorders. So future is absolutely combination of different methods of management of amblyopia. Thank you so very much.
Thank you, sir. Thank you for the novel approach towards amblyopia. So amblyopia actually is not a uniocular phenomenon where we need to patch the eye. Nowadays, a lot of new treatments like orthoptic and dichoptic exercises have coming. What is your, when you compare the phakic IOL, the outcome in unilateral myope versus the orthoptic exercises?
So in the densest of these isomyopic and the anisomyopic, we use phakic IOLs. So visual acuity improvement was faster in the phakic IOL group. But it took stereo acuity and the contrast sensitivity, it took a longer time in the phakic IOL group. So now what we are planning in a newer study that we need to combine these studies. So after putting phakic IOL, so no glasses is required now, or minimum, very minimum glasses are required. And then we can opt for OCCLUT and the orthoptech. Those patients are improving very fast.
For this orthoptech, how frequently you advise the sessions, because it doesn't work every time within one session. It doesn't improve. So how frequently you advise?
So we are doing weekly, alternate day for 20 minutes with the amblyopic eye. And the problem is in the orthoptech magnocellular stimulator, when we first started, so results were not good. So then we get to know that we need to sit along with the patient, we need to sit along with the child, we need to keep them motivated. So we need to keep them occupied. So they were not doing it. But once one of our staff was sitting with them, so the results were really good.
Yeah, I agree. The result, and we are also using the results are good. Any experience for strabismus improvement pre and post orthoptech?
Yeah, we are also doing it in strabismic amblyopia. So degree of the strabismus is also decreasing. I don't know why. In few of the strabismic amblyopia, the degree of the strabismus has decreased. I don't know why.
Because in our study, we could not find any difference in strabismus, but we definitely found the difference in contrast sensitivity.
Nystagmus also improved.
And yeah, nystagmus, contrast sensitivity, and stereo acuity.
Thank you, sir.